So this is healthy microbiota. So what can we see in healthy microbiota? Dots, 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 about not moving bacteria, air bubble here, epithelial cell, air bubble again, not much bacteria because this is a healthy patient. Healthy patient has not that much bacteria. And even I always ask 12 hours without brushing when they comes in. So I see some microbe within the sulcus, but this is 3 mm sulcus, just dots, 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 and some line. Okay. See, there's no white cell, absolutely no white cell. Oh, a couple there, okay? A couple there. So it's not hyper perfect. It's just one scavenger neutrophil you can see, but there's no disease, okay? Bacteria are fine, dots and lines. So this is healthy microbiota, dots, dots, dots and lines, filaments, not moving filament, epithelial cell on the lower right, and you have this mix of Corynebacterium matriciutis, dots and lines, okay? So actinomyces and calcari. So this is normal biofilm. Wherever you are, any patient, any age, any whatever you like, there is no inflammatory cell except one scavenger. This is common cell biofilm. This is also the goal we have to reach to cure. If you don't get there, if you still have red complex, orange complex, of course you're not cured. You have some remission, but we don't want remission. We want complete cure, complete healthy microbiota. And this is what we obtain from this microscope environment we look at. So let's see again gingivitis. What is gingivitis? Here on the film with the patient, what do we see? This big gingivitis. See how big it is? You know, big gingiva gum line is like this. We look at the case, we think it's periodontal disease. It's not. There's no pocket higher than 4, no bone loss at all. It's just big gingivitis. So what do we see? Neutrophil everywhere. So those cells, 15 microns, 10 of them are neutrophils. So this is the answer of the patient. Some epithelial cell, mostly spirochetes, red complex, some Vibrio, some bacilla, but most are spirochete in this case. And normally in gingivitis, microbiota, more or less spirochetes you'll find. But see what's in there. There is no parasite in either health or either gingivitis. No parasite because no bone loss. You'll see that all the time. Now look at periodontitis microbiota. Of course, I'll do some PCR. All my patients, they have this PCR with red, orange, and green, and I'll do it all the time. I like to know about those bacteria. But the most effective thing is the microscope. See this amoeba. This is an amoeba, we know, because it has a 4-micron nucleus with chromatin and karyosome in the center, and plenty of neutrophil, and bacilla, and spirochetes, and vibrios, okay? Orange and red, neutrophil, and plenty of amoeba. See the amoeba, those are very big, like 50, 60, sometimes 80 microns. So you can't miss it if you look at your microscope correctly. So see how it goes like this. It's like a larvae going like this with the pseudopode. It goes around and it feeds on nucleus of white cell and it feeds on red cell. So of course it's no good to keep. All patients that see those or their parasite going like this with the pseudopode, what is this? I mean, those are larvae parasites. Yeah, we find them in periodontal disease and all active periodontal disease. We see the bacteria too, so we're going to remove them all. We'll remove the amoeba. See here, 3 amoeba. It's a lot of them. Some bacilla, less spirochete, mostly bacilla, orange complex, red complex, and parasite. So this is microbiota of periodontitis.